Hello, everybody. As I mentioned in the previous slide, my name is Katya, and I will be discussing a general overview of conflict management and problem solving. And I feel that the best way to do this is to discuss a couple different types of conflict that we may face in the nursing field. So, the first kind of conflict that I'm going to talk about, it'd be task-based conflict. So, this could occur regarding when two nurses disagree on the application of a particular skill or handling a particular procedure, and this could mean any number of things. A couple of examples could be how to properly perform a sterile dressing change, or IV insertion, or Foley insertion. So, a nurse may have been taught a different way in school or have a different experience, and they might disagree with how someone is doing the task, and which could create tension and conflict and disagreement. This could be a pretty simple issue to resolve, as there are often a clear answer on how something should be done. So often charge nurses are a great resource and could be referred to for that information, or even better, referring to hospital policies, which are concrete and often explicitly define how the hospital administrators have decided that most procedures should be handled. So that's just that would be a task-based conflict. The second form of conflict would be a difference in beliefs in values or spiritual or religious beliefs. So this is also relatively self-explanatory, in which a nurse may not carry the same beliefs or values as a nurse, or vice versa, and this could create disagreement and tension. A couple examples would be ethical issues, such as end of life decisions, and beliefs in how religion ties into medicine, or their spiritual beliefs, and there may be some disagreements regarding this. And it's important to understand that we may have different beliefs from our fellow nurses or doctors or even our patients. However, we should always be respectful towards the informed decisions of our patients. The last form of conflict I'm going to discuss would be interpersonal conflict. And this conflict represents disagreement between nurses for more personal reasons, such as contrasting personalities or communication styles that make it challenging to work together and communicate and all in all get along, just because you just are just different as people. Interpersonal conflict can also include issues such as bullying, which unfortunately is very common in nursing, especially with new grads like ourselves and new hires on new units. So it is important to recognize these different kinds of conflict that we may be involved in as nurses, and it's important to recognize that all the different types of conflict are going to negatively impact our patients and our ability to perform and carry out patient care. So understanding the type of conflict and the root of the problem will help us best approach our different types of conflict management and problem solving skills, which we will further discuss in this presentation. And being accountable for our own roles in the disagreements or conflict is the first step in recognizing the problem and finding the right way to address the issue. Thank you.